What are the benefits of outpatient surgery and why is it becoming more popular? This is a question that we get all the time. And I think it's important to look at this from a few different perspectives. Really, if you take a sort of a 10,000 foot view and you look down, there's several things that have happened that are actually changing what we do. So let's start with the health systems. At a systems level, there's a push to reduce cost, and there's a push to minimize complications, and decrease length of stay is one of them. So obviously the clear solution to that is, well, if you send people home the same day, then that's a pretty short length of stay. So I think that that's one phenomenon that's happening. I think the other is from the patient standpoint. So we've been doing outpatient joints long enough now to know that they are safe. And if you select patients correctly, they can be done safely outpatient. They can go home, and the outcomes can be as good as if they were to stay in the hospital traditionally. The other thing is sort of from the patient standpoint, the enhanced comfort. So being able to recover from your own home with the amenities that you have at home, taking the same medication essentially that you'd be taking if you were in the hospital. And that kind of gets us into this pain protocols that have changed and really developed, and I think have fundamentally changed how we're able to perform these surgeries. And we'll get into that in a second. But when you think about where we are right now, things are very different. So what made it possible to do outpatient surgery, I think, has been a number of things. First of all, our volume has gone up substantially. We're doing more joint replacements now than ever. And it's not just on a nationwide level. Individual surgeons are doing more. We're doing more cases per day and more cases per year. And as a whole, that translates into advanced protocols, more comfort with different types of patients and scenarios, dealing with complications. It's more standardization along the process, and that's all led us to be able to send people home the same day. Demographics have shifted, and that can't be negated either. So if you look at the population that we're operating on now, over 50% of them may be younger than 65 years old, and that wasn't the case in the past. So we're dealing with patients who may be younger, and in the patients that are older, we're seeing older patients be more active now than ever. And so their expectations have changed. So it's really been a shift in sort of the patients that we're treating with joints. Not that we don't treat older people with joints as well, but we're seeing as a whole, the population has shifted slightly. And I think also the expectations have changed. So expectations, not just of us as surgeons, but also the patient's expectations. They don't necessarily want to stay in the hospital longer, and they don't necessarily want that kind of care. They want to go home. And I think it's a self-selecting process. And if people want that, then inherently they've selected into that model, and they're going to do well. And we've seen that. In terms of what the benefits are specifically, I think the real benefits are just that it allows patients to engage more in the process earlier on. So by leaving the hospital, the onus falls on them to manage their care. And a lot of people, like I just mentioned, for a lot of reasons, they like that. And so I think that's a really valuable asset to this whole process. And it's one of the reasons that people choose to do that.